Wyatt. I'm going to be your student nurse today. What's your name?
Lena Robbins,
Okay. And what's your date of birth, Lena?
7/27/95.
Okay. Your wristband matches your chart, so that's good. So what brings you in today?
A head to toe assessment.
Oh, okay. So before we get started, I'm going to close the curtain. I'm going to wash my hands. So do you know where you are?
The College of Nursing.
And do you know what today's date is?
April 19th, 2017.
Okay, perfect. So the patient is oriented ×3. She knows her name, she knows where she's at, and she also knows the date. So before I get started, I want to let you know that the head-to-toe assessment is going to be hands-on, so I'm going to have to touch you. But if you feel any discomfort at all, just let me know, and then I'll stop the assessment, okay? And before you start, are you allergic to anything?
Yeah.
No? Okay, great. So I'm going to start at the cranium, or the head, and I'm going to just palpate over. I'm feeling for any lumps, looking for any lesions, and I'm also just checking to see if the hair is evenly distributed, and it is, which is great. The eyebrows and the eyelashes are also evenly distributed on the patient's face. That's really good. So I'm going to palpate for the temporal pulse. It's there. It's bilaterally equally on both sides, and it's 2+. Okay, so now I'm going to check for the patient's ears, for any tenderness, any lumps. Any tenderness?
No.
No lumps, and both of the ears are symmetric on each side. And I'm also going to check on the inside. Okay. Okay, there's no exudate, no excess fluid coming out, so that's great. And now I'm going to check for your hearing test. I know the patient can hear me because she's being cooperative during this assessment, but I'm going to do one more test just to make sure. Can you hear this? Yeah. Okay, great. So now I'm going to check for your eyes. The patient's sclerae are white, and can you look up for me? Conjunctiva is pink and moist. So now I'm going to check for perla. So I'm going to ask you to stare at the wall here. I'm going to check for your pupil. Okay. Okay, great. Okay, now as you continue to stare at the wall, I want you to now focus on my finger. Okay, great. The eyes are perla. They are equal, round, and react to light, and they also accommodate. So now I'm going to check for the 6 cardinal field gaze. So I want you to stare at the pen, and using all your eyes, just follow the pen for me. The patient was able to follow the pen, no abnormal eye movement, which is good. So now I'm just going to palpate for your sinus cavities and your lymph nodes. Tell me if you feel any pressure or tenderness. Anything? No? Okay, good. So now I want to test your nose. So can you please hold one nostril for your patency? Breathe in, out. Other side, in and out. Okay, now I just want to check up in there, okay? Great. Nostrils are pink and they're not too dry, they're not too moist. So now I want you to open your mouth. Okay, can you stick your tongue out and say ah?
Ah.
Okay, good job. Patient's soft palate and the uvula was midline, and it also was rise when she said ah. So now I want to check for the throat. So moving from the head down to the throat. So I want to check for the trachea to see if it's midline. And it is. Okay. Now I also want to check for the carotid. Pulse, one at a time. It's there. No thrills, 2+. Other side. Equal, bilateral, no thrills, 2+. So now I want to listen for any bruise, which will be an abnormal sign in the carotid. Alright, so I'm going to listen with the bell of the stethoscope, and I'm going to ask you to just take a deep breath and hold it. Okay, relax. No bruise where hurts, which is good. No abnormal sounds in the carotid. So now I'm going to go to the chest, and I want to Just inspect my patient. I see that she is breathing normally. She doesn't have any type of distress. I don't see that she's like having a hard time breathing. So I want to go ahead and listen to her respiratory sounds. So I'm going to start anteriorly and with the diaphragm. So I just want you to just breathe normally. Alright, can you lift your hands up? I'm going to check laterally. Okay, I'm going to come to the other side and check. Okay, and now I'm going to check posterior. You can relax your arms. Okay. So I didn't hear any adventitious sounds when auscultating for respiratory. I didn't hear any wheezing or bronchi, so that's a good sign. So now I just want you to turn this way, and I'm going to check your back for any tenderness. Let me know if you feel any tenderness. None? No. Okay, great. So now I'm going to check the patient's back for thoracic expansion. So when I ask you to breathe in and just exhale normally, okay? Okay. Okay, breathe in. And patient's thoracic, the patient had equal and bilateral thoracic expansion, so that's great. So I'm now just going to actually just turn back around. And now I'm going to check for cardio sounds. I'm going to start with the diaphragm. So no abnormal sounds were found, but I am going to auscultate the apical pulse for 1 full minute, and then after I auscultate, I'm going to also auscultate for murmurs using the bell of the stethoscope. So I'm just going to ask you to slightly move forward, and I'm going to auscultate for 1 full minute. Okay, the patient's apical pulse was 72, which is normal. S1 and S2 was heard normally, and that's normal for this patient, which is good. The normal range is 60 between 100. So now I'm just going to also take for any murmurs using the bell. No abnormal sounds were heard using the bell, no murmurs, which is great. And now I'm just gonna palpate for any tenderness anteriorly. You feel any tenderness? All right, perfect. So now I'm just gonna have you lie back, and I'm going to just first inspect the abdomen. So the abdomen seems fine, no pulsations. Okay. So the abdomen seems normal, no pulsations that I can see, and the patient is breathing normally. I see that the costal angle is at 90, which is great, and then I see the rib cages are coming down at a 45-degree angle, which is great, perfectly normal. So now I'm just going to start with auscultating for any bowel movements, if that might be in the stomach, and I'm going to palpate each 4 quadrants, 5 to 15 seconds, which is going to be normal, and if I don't hear anything, then I'll auscultate for 1 full minute in each quadrant, using the diaphragm. Okay, so after auscultating, I didn't hear any abnormal bowel movements. The patient's movements were normal active, which is pretty normal. And so now I'm just going to check for the APL, and the APL is 1 to 2, which is normal. And so now I want to listen for any vascular sounds using the bell before I palpate. Great, no vascular sounds were heard, which is perfectly normal. So now I'm just gonna just palpate the stomach and just tell me if you feel any discomfort, okay? Or tenderness. No tenderness? All right, perfect. So put your shirt down. I want you to stay in lying position. I'm gonna look to dorsiflex your foot and tell me if you feel any discomfort.
No.
Any discomfort?
No.
Great, that is a negative Homan sign, which is perfect. So I'm gonna ask you to come up. Okay, so now I'm gonna test your peripheral, so I'm gonna ask you to roll your sleeves up. Okay, great. So I'm gonna check the patient's temperature just throughout the body. Temperature is normal. And I also want to just check for any skin lesions, skin discolorations, or scars. Patient doesn't have any scars, lesions, or discolorations, which is great. So now I want to check the fingernails. Fingernails are round, pink color, which is normal. Let's see, hands smooth and intact. So now I want to check for capillary refill. Okay, it was less than 2 seconds in the toes. Less than 2 seconds. And now I want to do the grip test. So just grip my fingers. Okay, grip test was good. Patient strength is 5 out of 5, which is great. I don't see any edema, any swelling of the legs, so that's also great. So now I also want to check for the pulses. So I'm going to start with your radial pulse. Pulses are equal, bilateral, 2+, no thrills. Radial. They're both present, 2+, no thrills, and the posterior tibialis, no thrills, 2+, both present, and the dorsalis pedis. Okay, they're both there, 2+, no thrills. Okay, so now I want to test for sensation. So when you feel this is gonna be dull, this is gonna be sharp. So just let me know which one you feel, and I want you to close your eyes, okay? Okay. Sharp. Dull. Sharp. Dull. Great. And then keeping your eyes closed, let me know when you feel this.
Okay. I feel it. Feel it.
Okay, so that's good. Patient sensations are intact. So now I want you to stand up. And I'm going to test your gait. So I just want you just to walk to the door. And walk back heel to toe. Great. Okay, now standing there with your feet together and your arms by your side, I want you to close your eyes. Great. So you didn't sway or lean, that's good, which is a negative Rumberg sign. So that's good. Okay, so now I want you to check for your range of motion. So just repeat after me with your neck coming forward, back, side to side, and then put your arms up, down to the side, circular, and then also your legs, back, legs, swing it, side to side. Good job. So also I want you to test for your facial while we're testing for range of motion. So
Okay.
I want you to pucker, blowfish, and clench your jaws. Clench your jaws one more time. Great. So facial movements are present, arm movement, extremities are there, range of motion is great. So the patient was very cooperative. She understood, was able to comprehend. I see that she has a normal cognitive function. So this patient is ready to go and she is all set. She's good. So that concludes my assessment.